As you enter your golden years, you might notice changes in your sexual health that weren't present in your younger days. Perhaps you've wondered if self-pleasure is still appropriate or healthy at your age. The truth is, masturbation remains a normal part of human sexuality throughout life, but there are some considerations specific to older adults worth understanding. First, let's address the benefits. Masturbation in your later years can help maintain blood flow to your genital tissues, which is important for overall sexual function. For men, it may help reduce the risk of prostate issues, while women may experience relief from vaginal dryness and atrophy through the increased blood flow that comes with arousal and orgasm. The emotional benefits shouldn't be overlooked either. Sexual release provides stress reduction and promotes better sleep, both particularly valuable as you age. It's also a way to maintain your sexual identity when partners may not be available or when health issues complicate partnered intimacy. However, there are some cautions to consider. If you have heart disease, check with your doctor about sexual activity, including masturbation, as it does temporarily increase heart rate and blood pressure. For those with arthritis or joint pain, finding comfortable positions or using assistive devices might be necessary. And gentlemen, if you're taking medications for enlarged prostate or erectile dysfunction, be aware they may affect your sexual response. Proper hygiene and lubrication become increasingly important with age. Your skin is thinner and may be more susceptible to irritation, so use appropriate lubricants and avoid harsh soaps or products that might cause discomfort. Most importantly, release yourself from unnecessary guilt or shame. Your sexuality doesn't expire with age, and self-pleasure remains your personal choice. If it enhances your quality of life without causing physical or emotional distress, there's no medical reason to abstain simply because of your age. Remember, maintaining sexual health is just one aspect of overall wellness in your later years. Stay active, eat well, manage chronic conditions, and keep regular checkups with your healthcare provider. Your sexual health deserves the same thoughtful attention as every other aspect of your well-being. How to adapt your approach to intimacy as you age is an important conversation many avoid. Beyond masturbation, there are several aspects of sexual wellness worth exploring as you navigate your 50s, 60s, 70s, and beyond. Communication becomes even more crucial during these decades. Many find it difficult to discuss changing needs with long-term partners, but this openness is essential. Your body's responses may be different now, perhaps requiring more time for arousal or different types of stimulation, and sharing these changes with your partner prevents frustration and fosters intimacy. Physical touch beyond intercourse often takes on greater significance. Massage, cuddling, and other forms of sensual contact can provide profound connection when other forms of sex become challenging. This expanded definition of intimacy often leads to more satisfying experiences overall. Consider exploring aids and adaptations without embarrassment. Lubricants, as mentioned earlier, are almost universally beneficial as natural lubrication diminishes. Vibrators and other devices aren't just for the young. They can compensate for arthritis, reduced stamina, or other physical limitations that come with aging. Many products are now designed with older adults specifically in mind. Your mental approach to sexuality matters tremendously. Research shows that those who maintain a positive attitude about their sexuality as they age report higher satisfaction. Rather than focusing on what's been lost, embrace what's gained, greater knowledge of your preferences, freedom from pregnancy concerns, and often more time to devote to pleasure. Medication effects deserve close attention. Beyond those mentioned for prostate and erectile function, many common prescriptions for blood pressure, depression, and other conditions can impact sexual response. Don't hesitate to discuss these side effects with your doctor, as alternatives or adjustments might be available. For those without partners, consider that dating in later life can be remarkably rewarding. Many find that age brings confidence and clarity about what they truly want in relationships. Online dating platforms increasingly serve older adults, and many community organizations offer social opportunities specifically for seniors. Finally, don't underestimate the power of overall health on your sexual well-being. Regular exercise improves circulation and flexibility, both directly benefiting sexual function. Proper nutrition supports hormonal balance, while adequate sleep enhances both desire and performance. Taking care of your whole self creates the foundation for continued sexual enjoyment throughout your life. How to navigate changes in sexual relationships and expectations as you age. As you continue your journey through the later decades of life, it's important to acknowledge how changing bodies and circumstances affect intimate relationships. Perhaps one of the most significant shifts involves adjusting expectations around frequency and performance. The spontaneous desire you may have experienced in your younger years often transitions to a more responsive desire pattern, meaning arousal might come after stimulation begins rather than before. This natural evolution doesn't indicate a problem, but rather an opportunity to discover new rhythms in your intimate life. Taking pressure off performance can actually enhance enjoyment. Consider adopting a playful, exploratory approach rather than focusing on specific outcomes. Many couples find that removing goal-oriented thinking about sex leads to more satisfying encounters. Timing becomes increasingly important as you age. You might notice your energy levels peak at different times of day than they once did. Perhaps mornings offer more vigor than evenings, or mid-afternoon provides an ideal window when medications are at optimal levels. Listen to your body's natural patterns and schedule intimacy accordingly. Health conditions that become more common with age require thoughtful adaptation rather than resignation. Diabetes, heart disease, and arthritis all present challenges to sexual activity, but rarely make it impossible. Working with healthcare providers who understand the importance of sexual health can help you develop strategies specific to your situation. Don't accept dismissive responses. If one provider minimizes your concerns, seek another opinion. For those managing menopause, hormone changes bring unique considerations. Beyond lubricants, options like localized hormone therapies can address vaginal tissue changes without the risks associated with systemic hormone replacement. Similarly, men experiencing testosterone decreases have various treatment options worth discussing with knowledgeable practitioners. Privacy considerations may change, especially if you're living with adult children or in a care facility. Maintaining boundaries becomes an act of self-respect, whether that means a lock on your bedroom door, scheduling private time in shared living situations, or having direct conversations about your needs with family members or caregivers. Perhaps most importantly, remember that sexuality in later life often deepens in emotional meaning. Physical changes may alter how you experience pleasure, but many report that intimacy becomes richer, more nuanced, and more satisfying when the connection transcends purely physical sensation. The vulnerability of navigating these changes together can create profound bonds with partners. Throughout this journey, maintain a sense of humor and adventure. Bodies of all ages have their quirks and surprises. Being able to laugh together through awkward moments preserves the joy in physical connection. Your sexual expression in these decades belongs entirely to you, shaped by your values, preferences, and circumstances, not by arbitrary standards or outdated taboos about aging and desire. How to embrace the ever-evolving nature of intimacy in your later years. As you journey further into your golden years, it's worth considering how the landscape of intimacy continues to transform beyond the physical aspects we have discussed. The emotional dimensions of sexuality often flourish with age, bringing unexpected gifts amid the changes. One of the most liberating aspects of sexuality in your later years is the freedom from others' expectations. You've likely spent decades navigating societal pressures about how you should look, perform, or express desire. Now is the perfect time to release those external standards and truly focus on what brings you authentic pleasure and connection. Many find that mindfulness becomes an essential tool for sexual enjoyment as they age. Being fully present in your body, without judgment or anxiety about performance, allows you to experience sensations more vividly. This presence often compensates for any physical changes, creating deeply satisfying experiences that younger, more distracted versions of yourself might have missed entirely. Your relationship with your changing body deserves compassionate attention. Rather than viewing physical changes as limitations, consider them invitations to develop new pathways to pleasure. The body you inhabit now carries your life's wisdom and experiences. Honoring it through gentle exploration can reveal unexpected sources of delight that weren't accessible in youth. For those navigating new relationships later in life, conversations about sexual health take on additional importance. Discussing STI prevention remains relevant regardless of age. Rates of sexually transmitted infections among older adults have increased in recent years, partly due to the misconception that protection is unnecessary after reproductive years have passed. Technology offers expanding possibilities for maintaining connection, even when physical limitations or distance creates challenges. Video calls, messaging platforms, and even specialized apps designed for couples can maintain intimacy during separations or illness. Similarly, adaptive technologies specifically designed for bodies with limited mobility or chronic conditions continue to improve, making pleasure more accessible. Your sexual well-being in later years often reflects how you've approached other aspects of aging. Those who remain curious, adaptable, and open to new experiences generally navigate changes in sexuality with greater ease than those rigidly attached to past patterns. Cultivating this flexibility in your thinking about intimacy creates resilience when adjustments become necessary. Remember that intimacy encompasses far more than physical acts. The deep knowing of a one partner, the vulnerability of sharing fears about aging, the comfort of familiar touch, these elements often become the most precious aspects of sexuality as you age. Many find that this broader definition of intimacy actually enhances their satisfaction, even as certain physical capabilities may diminish. Throughout all life seasons, your sexuality remains uniquely yours to express in ways that honor your values, preferences, and circumstances. By approaching these changes with curiosity rather than fear, you open yourself to discovering new dimensions of pleasure and connection that can bring unexpected joy to your later